Hello, thank you for joining us today on our webinar on understanding and managing deliberate self-harm in school settings. My name is Simon Dodd. I'm the Associate Director of Engagement at Orygen, the National Centre of Excellence in Youth Mental Health. Today we have Karen Marriage, one of our senior staff, who's talking to us about working with, in a school setting, young people who may be deliberately self-harming. Those who work clinically with young people know that deliberate self-harm is common in this age group, and many young people who are referred to see us with a range of presenting issues will present with self-harming behaviours also. We know people working in secondary schools are likely to have some contact or involvement with young people who self-harm also, so we understand. Deliberate self-harm is distressing for all affected, the young people themselves, their family and other students and staff at the school they attend. We know that deliberate self-harm can be difficult to understand and manage, and that often people are left uncertain if they're doing the right thing or if they can help at all. As this is an issue that people working in educational settings are likely to face, today is a good opportunity for us to think about how often and why young people engage in self-harm and the link between deliberate self-harm, mental ill health, suicide. Karen will also be talking about how schools can go about managing incidents of deliberate self-harm and the effects on the individual student, the other affected students and staff. We'll also discuss what we know is helpful for schools in order to develop policies and guidelines in managing deliberate self-harm. So Karen Marriage is one of our senior project managers and a senior clinical psychologist here at Orygen, the National Centre of Excellence in Youth Mental Health. Karen has more than 17 years of clinical experience in early intervention services with young people, and she has also developed and delivered a number of training and educational packages for mental health clinicians working with young people, and also other agencies such as Beyond Blue, Victoria Police, Youth Justice, as well as directly with schools. So we'd like to thank you, Karen, for your presentation today, and a reminder to you, our audience, to send through any questions you have, which we'll respond to after the presentations, and we'll be recording this webinar, and we are recording this, which will be available later, and I'll give you that URL at the end of this session also. In terms of the webinar control panels, on the right of your screen you'll see there's a place where you can write questions. The only people who see those questions are our moderators, and we will try to make the questions work for the presenter, and we might amalgamate a number of questions if they're on a number of themes. If we don't get to those, we will do our best to address them at a later time. Also within the webinar will be a number of polls. It's very useful for us if you can answer those best you can, and it allows us to understand whether we're on the right track and which themes we should focus on more during the session. So I'll pass that on to you now, Karen, and thanks very much for your presentation.
Thanks, Simon. Okay. We know that deliberate self-harm is a very big topic area. It's something that we would often run multiple days of training on for schools. And we have somewhere within the vicinity of an hour or an hour and a half this morning to be talking with you about it. So we're not going to be able to cover everything in a very comprehensive way. What my hope is that you have some time to think about this issue set aside in the next hour or so that stimulates your thinking about your role, how you might provide better services to the students and possibly staff and family members who are part of your school community, but also some opportunity to reflect upon what the processes within your school, how are they working? Are there parts of them that are working well? Are there parts of them that you should be going back to and having a review of? So we won't be able to comprehensively cover everything that you might possibly want to know about managing self-harm, but we hope that we get you thinking about what are your gaps, what would you like to know more about, what do you need to go away and do more of, and what are you doing well? Okay, so we're going to start with a poll question. First thing I would really like to know, just to get a sense of the audience, is what is your work background? So the poll question will pop up here, and we'd like you just to select one of the options, and that'll give me some information about where you've all come from. We know this is a very popular webinar today. We know from our work that this is an issue that is often very front and centre for schools who are going through difficult issues. So it would just help us to get a sense of who you all are, what your roles are, and that'll give us a sense of why you might have come along today. Okay, do we have any answers coming through? Okay, so it looks like we have some school welfare staff attending today, a few teachers, less of the sort of senior management in the schools, and other education staff. So I'm wondering whether that might be people potentially like school nurses or school psychologists, someone who isn't a teacher, principal or welfare coordinator. Okay, that's helpful to know. Okay, just find my slide again. Okay, so today if we are successful in managing the time constraints, the topics that we will be covering were what is self-harm, how do we define it, why it's important that we're thinking more about it. I think it's important that we spend some time thinking about why do young people self-harm. It's a very important question because the answers can be varied, and depending on why a young person is self-harming, you might be guided into different areas of intervention. The things you might do would be different. The way you would respond would be different. So I think it would be helpful just to spend a couple of minutes thinking about why a young person might be self-harming. I'll give you a little bit of data about how common it is, have a little bit of a think about what the impact might be within a school. People are often quite concerned about the idea of if somebody is self-harming, does that mean that we need to be worried that they might end up dying? So we'll have a little bit of a look at the relationship between self-harm, suicide and other mental illnesses. We hope to keep some time to have a think about what are some of the principles that might guide schools in how they respond to instances of deliberate self-harm. I think that is where actually some of the important thinking will happen. And if you can go away motivated to have a look at how are your policies working, do you have them? Does everybody in the school know what their role is and what it isn't? And then we'll save some time at the end for some questions. Okay, so we know that self-harm can have a very big impact on school communities. For the student themselves, but also can be very distressing for staff, other students who might have heard about or witnessed the incident of self-harm, families of the student and other families who might be worried about their own children witnessing self-harm or hearing of it. And it can evoke very strong reactions and very different reactions within a school setting. Some people might feel very worried or very anxious. Some people might feel angry or manipulated, or like this is very much not part of their role as an educator. So I think it's important just to remember that the reaction that you're having might not be shared across the entire school community. People can respond very differently to these instances, but almost universally coming across a student who is engaging in deliberate self-harm evokes strong reactions in the people who are around them. And we really commonly hear people in schools, but also within our own mental health services, people worry a lot about are they doing what they should be doing? Is there more they could be doing? Should they be doing something differently? Nobody wants things to go very wrong when they care and when they have a role. So we hope that today you have a little bit more confidence and a little bit more of a sense of what it might be that you can be doing, and where would be the line about where you should be passing these things over to other services to manage, or working in collaboration with you with other services. Okay, so that's just a slide that outlines some of the really common reactions that people might have when they learn of instances of self-harm for students. Why me? I'm not trained to manage these behaviours. Will I be able to tell what the risk is? So already I can see that we've had a question come through asking, how do we distinguish between simple self-harm or attention-seeking and serious self-harm behaviours? And that is a very difficult and complex question that we can't always be 100% certain about the answer, but we'll talk a little bit about risk as we go through the presentation. Okay, so what are we talking about when we talk about self-harm? What's in and what's out of the definition? The definition of suicide is one that is probably clearer. We would define suicide as somebody intentionally causing their own death. But self-harm is a little bit more complex. What's in and what's out? The most common forms of deliberate self-harm would be cutting, scratching and burning, cutting actually by a long way, the data tells us. But we would also include things like banging or punching self, or intentional overdoses or self-poisoning. They would typically be included in the definition of self-harm. So really we're talking about the deliberate harming of oneself regardless of intent. So if somebody's doing something to deliberately harm their body, it doesn't matter whether they do that with the intention of causing their death or not, we're counting that in the definition of self-harm today. Usually substance use and self-starvation or eating disordered behaviours aren't included. But you know, that's a grey area. But within the research data, those types of problems are often excluded from the definition of deliberate self-harm. Okay, so we're going to ask you a couple more questions. We know that there are a lot of very strongly held beliefs, sometimes myths around self-harm, and it might be useful for us to have a look at a couple of those myths a little more closely before we get started, and for me to see your responses to them and to have a think about how much truth lies in them. So the first one we have, and we'll put it up as a poll question, is that people self-harm to get attention. I'd like to hear your responses to that before I talk too much further. What do you think? Do you think that that is true or false? It might be kinder to you to have a maybe or a sometimes option, but we're giving you a forced choice for this one. So I'd like to have a look at your answers. Do you think people self-harm to get attention? I'll give you a second for the answers to come through. Okay, mostly false. So it looks like 17% of you say that that is sometimes true, but most of you are saying that's false. And actually, that's encouraging for me to see you say that. What we look, it's a grey answer to a complicated question. We know that most young people who self-harm do so in private, that most of them are not coming to the attention of people like their teachers or the staff at school, or to mental health services for that matter. And the data is quite staggering. It's a quite a large majority of young people who do engage in self-harm aren't letting people know about it. So I think the overwhelming correct answer that the data would indicate to that question is that people aren't self-harming to get attention as a rule. But what we do know is that sometimes people self-harm as a way of communicating something. So sometimes there is a message behind their self-harming intended for other people, either that they're distressed or that they're wanting help or that they're struggling to cope with something. So self-harm can sometimes be seen as a communication to other people, but by far and away, we're happy to hear that people think that it's not an attention-seeking or a manipulative behaviour in most instances. Okay, so the next poll question. People self-harm as they like to feel pain. What do you think about the answer to that question? I'll give you a minute to answer. Less than a minute. Okay. Got some answers coming through. Let's have a look at them. False. Okay, 76% of you thinking that that is untrue. It's another tricky one to answer. There are multiple reasons that people might be self-harming, and we'll go through them. They vary sometimes even within the person. Interestingly, some young people, that if you were to ask them why they're engaging self-harm, I think a minority possibly would answer that they do feel pain, and that the pain often distracts them from other things that are going on or makes them feel real, or that it's something about feeling the pain that can be helpful for them. So although that would certainly not be the response that most young people would give you when you're asking them why they engage in self-harming, some young people might say that the pain is helpful for various reasons that we'll talk about later. Okay, so we have another poll question coming up. What do you think of this one? Once people start self-harming, they'll always be addicted to it. I wonder if that's something that you've heard students talk to you about. Once people start self-harming, they'll always be addicted. Okay, let's have a look at the answers. False. Okay. Now, I wonder if people have responded false because you very strongly responded that that is false, and I wonder if that's because of the strongly worded nature of the question, that they will always be addicted. You are correct that they won't always be addicted, but I've very much spoken to young people who will tell me that they might start self-harming for a particular reason at a time when they're particularly distressed, perhaps. And that even sometimes after that distress has gone away, for some young people it can be difficult for them to cease their behaviour. And they talk about it in a very similar way sometimes to how people might discuss other addictions. We know that when people feel pain, endorphins are released. We know that adrenaline is released, and that can have a physiological impact on your distress. So it may be that there is a bit of a biological reason that young people can find it difficult to stop harming themselves if they've done it for a long period of time. Also, we know that they can find it difficult to stop if they don't have other coping strategies to replace it with, and I think that's a very important thing to remember. It is very difficult to ask a young person to stop self-harming, which is very much what we would like to ask them to do. I know of schools who have said you won't be welcome back at this school if you continue to self-harm. For many young people, it is a very difficult task to stop self-harming in the absence of assistance with whatever it is that's distressing them, but also without having replacement coping mechanisms for the self-harm. It's a very powerful coping mechanism for many young people. Okay, I think this is our final poll question for now. When people talk about their self-harm, it usually makes them feel better. What do you think about that one? Okay, we won't take too much longer. Let's have a look at your answers. Okay, much more evenly aligned, and I can understand why that would be. Some young people will describe that they feel a great sense of relief if somebody actually asks them about their self-harming. Because it is such a hidden behaviour for many young people, there's an enormous amount of stigma and shame for many young people about this behaviour. It is not something that most young people are wanting others to know about, but they're often really confused. Why are they doing it? It's counterintuitive that you would hurt yourself in order to feel better, but yet that's how it makes many of them feel. So I know that many young people will feel quite relieved at having somebody directly ask them about their self-harm, and that might make them feel better because they'll feel like they're not alone, that they're not the only people experiencing this, and that there may be something that can be done to help them get through this time that's a bit scary and a bit confusing. It doesn't always make people feel better. Some young people prefer it to remain hidden. There are many young people who just want us to go away and stop hassling them about this. So I understand why we had, quite an even spread on the answers to that question. Okay. Oh, I do have one more. This is a really important one that I want to get you thinking about. If I talk or ask about self-harm or suicide, I might put ideas into someone's head. I wonder what you think about this question. Do we have any answers about it? Okay, let's have a look. Oh, that's absolutely terrific to see. That's very reassuring. The data is increasingly clear about this, that we are not going to make somebody think about the idea of self-harming, or we're not going to make them think that their life would be not worth living if we ask them about it. If I asked you right now whether you were having thoughts of ending your life, if you weren't, you weren't. And me asking you that is very unlikely to make you suddenly think, oh, that's a great idea. So we know from working with people that it's a question that is very difficult to ask, and that people are sometimes reluctant to ask that question for a range of reasons, sometimes because they don't want to make things worse, which is understandable. But we would very strongly like to encourage people that if you don't ask these questions, you won't know. And if you don't know about the risk, you can't make sound decisions based on that information. So we're really pleased to see that most people would say that they know they're not going to make it worse. They won't be putting ideas into someone's head. So that's very encouraging. We would like to really reinforce that point, that that if you're concerned about the well-being of a student, we would really encourage somebody, an identified person who has a role or a rapport with that student, to feel confident to ask, and that they won't be making it worse by doing so. Okay, so why talk about self-harm? We've already touched on this idea that it's a very misunderstood and highly stigmatised behaviour, and that makes it very difficult for young people to feel that they will get a helpful response or a compassionate response or an informed response, and that can make it very difficult for them to take that step to seeking help. So we think, you know, not just within schools or within mental health services, but we would like to see people talking about self-harm in a much broader community sense, because it is a very hidden behaviour that is very difficult for young people and their families to seek support about, because there's so much shame and so much stigma around it. So it's a misunderstood behaviour. We've talked about the idea that it often goes unnoticed, that young people are often self-harming in private, and that a large majority of young people who are self-harming don't seek help for it. So I think that's a really good reason that we should be focusing on it. And that often the responses that young people get if they do disclose that they've been self-harming are not great. They'll often get quite uncompassionate responses, or punitive responses, or frustrated responses from people or health workers saying, "You've done this to yourself." That people feel manipulated, people feel angry. That's a very unhelpful response that makes it very difficult for young people to subsequently help seek. So we think people need to be more informed about some of the reasons that young people are self-harming, so that we can start to break down those patterns that that make it so difficult for young people to seek help about their self-harm. A little bit about the data. It's quite striking, actually. Actually, this data's a little bit incorrect. I'm not sure it's the latest version of this slide, actually, but I'll talk you through it. Really recent data tells us that about 24% of Australian young women, so this is female data, aged between 20 and 24, have engaged in self-harm in their lifetime. So that's huge. If you think about the people leaving your secondary schools, that's about a quarter of them at some point in their lives have done some self-harming, young women that is, and that up to 17% of 15 to 18-year-olds young women again, have engaged in self-harm. The rates are lower for young men. So from memory, they were several percentage points lower than it is for young women. So it's a very, very common behaviour for young people. Now, not all of those young people who are self-harming are doing very dangerous or damaging things or are engaging in it more than once, but these are numbers that tell us that up to a quarter of Australian women before the age of 25 have done something to harm their own bodies. Okay, yep, so there's the data. So 11% of young males, 18% of young women. Okay. We know that self-harm is likely to be on the rise. Data isn't systematically collected in Australia. What we do have is hospitalisation rates for people who have engaged in deliberate self-harm, and we know that they have absolutely increased in the last decade or more, particularly for young women, particularly for 15 to 18-year-old young women, and particularly for people who have engaged in self-poisoning. So although things like cutting and burning might be the more commonly engaged in behaviours, people are much more likely in the last decade to be hospitalised after an incident of self-poisoning. So we have reason to believe that self-harm is on the rise in Australia. We also know that the consequences for young people who engage in self-harming behaviour are often very serious leading into their adult lives. So there is an increased chance of them completing suicide and having other causes of premature death. We know that they have increased rates of mental health problems into their adulthood, poorer physical health outcomes, more substance abuse, more things like traffic accidents, which is an interesting correlation. So somehow or other, these young people who are engaging in deliberate self-harm are getting themselves into all kinds of trouble, poorer economic participation. And we also have a lot of data about the impact on families. We know that families where a young person is engaging in deliberate self-harm have much poorer outcomes in terms of their own mental health, in terms of their connection to other people. It's a very difficult behaviour for families to have to manage. Okay. Now, in terms of thinking about your student populations, there's increasing evidence that some groups of young Australians are at greater risk of engaging in deliberate self-harm. So I thought I would just quickly talk to you about some of those groups of young people, because there's quite clear evidence that before we even speak to young people, that we know that some of your students will be at greater risk statistically than others. And those young people are same-sex attracted, LGBTI young people. Some data quite recently was that 37% of LGBTI young people had thought about self-harm. 31% had harmed themselves in the previous 12 months. So they're really high rates, much higher than your average young person. And that the rates of self-harm are highest in those young people who have experienced homophobia. Now, I think that gives schools room to be thinking about what we do to assist our same-sex attracted, gay, lesbian, gender questioning young people in our schools to not be experiencing homophobia within your schools. I think that's a question that you really do need to be thinking about, because the rates are really high in young people who have experienced homophobia. We know that Aboriginal and Torres Strait Islander young Australians are also at much higher risk of both self-harm and of death by suicide. So that's another group of students that we would like you to be conscious of when you're thinking about who you should be thinking about supporting and responding to. We know that females are at a greater risk of engaging in deliberate self-harm to quite a large ratio. Young men, that doesn't mean they're not at risk. Young men are more likely to actually die by suicide, but young women are engaging in self-harm at a much greater rate than young men. And young people with mental ill health are at much greater risk. So we know particularly young people who are diagnosed with depression are at greater risk. So if you know of students within your school who are being treated for illnesses like depression, you should be thinking about what's happening for them. Are they engaging in deliberate self-harm? And almost by definition, individuals who are diagnosed with personality disorders, 91% of those had engaged in self-harm. Now that's a little bit of a reporting bias there, because one of the criteria by which some of the personality disorders are judged by is that people have engaged in deliberate self-harm. But so if you do know that young people are having treatment for mental ill health or have mental ill health difficulties, you should have deliberate self-harm on your radar. Okay, a couple of other groups. Young people who are in juvenile justice facilities are at much greater risk of engaging in deliberate self-harm. So if you've got students who have fallen on the wrong side of the law, you should be thinking about what's happening for them. They're young people who have often got a lot of social disadvantage, so they're a risk group. Also, similarly, young people who live in out-of-home care, they're 4 to 5 times more likely than age-matched peers to have harmed themselves. So there's some of the groups that we think you should be thinking about in your student populations. Okay. We do know that young people who engage in self-harming are 4 times more likely than the rest of the population to die by suicide. So now I will talk about the ones who don't, but we do want you to be thinking about that for some of the young people who you work with who may be harming themselves, some of them are at a much higher risk of dying suicide. So we should very much be concerned about how are we conducting risk assessments with these young people? How do we make a decision that is informed about which of them we should be most worried about? Because the risks can be catastrophic. But on the other side of the ledger, we know that not all cases of self-harm are intended to be fatal. So the number of young people who engage in self-harming behaviour is 40 to 100 times greater than those who have actually ended their lives. So what that tells us is that most of your students who are harming themselves are not intending to die, that most young people are not harming themselves with the intention of ending their lives. So although that may be reassuring, we know that they are at greater risk of dying. And so really all self-harm should be taken very seriously. What we should keep in mind, and I think it's a really important point, is that for many young people, self-harming, they'll describe it to you as a way of coping that allows them to continue to live rather than to end their lives. So it's something sometimes that stops them from doing something more serious, that it helps them to get through times that are very distressing, that they don't have other ways of coping with. So for many young people, it actually isn't self-harm isn't done with the intention of ending their lives, but more as a way of staying alive and continuing to manage things that are very difficult. So I think that is worth thinking about. But what we do know is that young people are not always very clear about what the consequences of their behaviour will be, that they may be doing things that are more dangerous than they realise. And actually the opposite can be true. They may be engaging in behaviours that they think may end their lives that are very unlikely to. But the risk of accidental death can be high. So we really want to strongly emphasise that take-home message that all self-harm needs to be taken seriously. If a young person in your school is self-harming, they really do need to have the risks assessed regularly by somebody who is qualified to do so, and that might mean referral to a mental health service if you don't have access to those people within your school setting. And a proviso about that, risk assessments need to be repeated. So somebody's risk today might be low, but in a fortnight something additional might be distressing them. And so risk assessments shouldn't be just done one, filed away and never repeated. Okay. So the reasons that young people self-harm are actually really important, and we want you to be thinking about them because the way you might respond to a student and the plans you put in place might be different depending on what some of those reasons are. And here's a bit of a list. So we've talked about, for many young people, it's a way of coping with feelings that are very big. They'll often talk about very intense, strong, distressing, negative emotions, or thoughts or memories. For young people who have had instances of trauma, it might be that when they're having very strong memories of the traumatic event, that it's a way of getting through those periods of time. Young people will describe that it helps to reduce that distress in some way, and that's almost a universal description, that it takes away the distress in the moment for them. But there are other reasons. It can be punishing of yourself, hate towards your body. So it often happens with people who have had instances of abuse where they're feeling that they've done something wrong, or they feel shame, hatred toward their body. We talked earlier about young people feeling like they want to be heard. They might be expressing anger at themselves or other people. Very rarely, but occasionally, it's in response to psychotic symptoms where young people might be responding to a voice telling them to harm themselves. Less common, but possible. Quite common will be a description for young people talking about wanting to gain control of something that feels very out of control in their life, gaining some relief from strong feelings, occasionally to elicit a response from others, to get some care, to give a message, to let people know what's going on for them. Young people might describe to you that it helps them to feel real, that sometimes they feel a bit dissociated or a bit outside of their own body, and the actual act of harming themselves helps them to feel connected back into what's real again. It can help some young people feel like they're accepted into a peer group, and that's a problematic one for schools, and hopefully we'll get time to touch on that a little bit more as we go. But almost always it's to decrease emotional pain. So there's some of the common reasons that young people self-harm. And here's a quote from a young person. "The reasons I self-harm differ every time. It could be an impulsive reaction to something, in which case I self-harm before I even have time to think about why. I've also self-harmed because I felt I had to, for no particular reason. It just felt like I had to do it, an intrusive thought. I've self-harmed to be hurt or sick because I felt that I needed to, or I felt that I needed to be punished and I deserved it." And then there are times when the self-harm is an attempted suicide. So I thought that was a really useful quote, because it helps you to think about, even within the one young person, there might be different reasons at different times for them self-harming. So it's not always one reason for each young person. Okay, so getting a little bit practical, some of the things that schools can do. There are many steps, and each one of these could have a whole day's training on them. But there are various levels at which you can think about self-harm within a school environment. You could be thinking sort of macro, whole school mental health promotion. What are you doing for students to feel included and connected and like they belong? How are we encouraging people to feel okay about talking about mental health difficulties? How much do your students know about mental health difficulties? Do they know how to access help? So there are a whole of school things that can be very useful in a preventative type way that could be the focus of your school's attention. You can be thinking about how your school engages with individual students or the student body in general and with their families. You're going to think a little bit about early recognition of risk, and we have spoken already about there are some categories of young people who we know are at greater risk. it's important for schools to think about how they go about having risk assessments done. So we've spoken about the idea that that there can be very serious risk associated with some young people's self-harming behaviour and distress. Is that something that you can assess within your school? How do you go about getting that done? Whose job is it? Do you refer for it? What are the relationships like with your local mental health services, for example? So we want you to think about those things. How does risk assessment get done to inform your decisions within your school? Then after an incident of deliberate self-harm, there are immediate safety considerations, and we'll touch very briefly on some of those. And then it's about thinking about ongoing support options. What can the student be offered within the school? What about other students who are impacted by self-harm? Who makes referrals? Where are you referring to? How do you go about continuing to monitor a young person after an incident of self-harm has passed? How do you know if their risk is changing? How do you know if they're getting the support they need? So there's some of the very big things on one slide that a school could be thinking about when they're thinking about some of the steps for managing self-harm. Okay, so a couple of the indicators of self-harm. Clearly, if the young person's talking about, indicating that they've got ideas of self-harm and suicide, you would be concerned. That is a bit self-evident. You'd also be looking out for things like obvious changes in mood. The big one is losing interest and pleasure in things. So we spoke about self-harm being quite common when people are depressed, and these two are some very hallmark symptoms of depression. These are easier to pick up if you have an ongoing relationship with a student. So if you notice a change in them, if they've been a connected, engaged, sporty young person who then stops engaging in those activities, then you might worry about what's going on for them with their mood and with their mental health. Much harder to do if you don't have that sort of longitudinal picture of a young person's functioning. But I think schools are very well placed to have a longitudinal picture. If students are engaged and connected to somebody within the school, there's an increased chance that someone will notice if they're looking more hopeless or feeling more helpless than they usually do. Or whether some of these behavioural signs are obvious. And the behavioural signs are the things that people might know. It might be the teachers who notice, or it might be families noticing these things and reporting them to the school, or sometimes a peer group. Are they more socially withdrawn? Are they starting to have more problems with school? What's going on with their participation, their academic results? Are they more tardy or truanting more often than they usually would? Are they looking like they're having more trouble concentrating and participating in classroom activities? There may be changes in eating and sleeping patterns. There may be avoidance of situations where exposure of their body is required. So that might be things like at swimming carnivals, that they're reluctant to get into their bathing costumes because scars might be evident. So if you're noticing that it's a very hot day, for example, and they're wearing big heavy overcoats, and they're looking hot and sweaty, and they might normally have wanted to take those clothes off, you might be thinking, is something going on in relation to self-harm? Strange excuses for injuries, truancy. Unexplained injuries, that would be an obvious one. So if you're able to actually notice some evidence of some self-harm, that would be very much an indicator that you should be asking some questions about what's happening for them. But there might be more complicated things, like some unexplained physical complaints, pains, headaches. So we want to know what's happening there. Is it that they're more distressed, or are they taking regular overdoses of something? So they might be just little indicators, red flags, I think maybe someone should be asking this young person how they're going. Okay, so we know that there are some long-standing risk factors for deliberate self-harm. They're very similar to some of the risk factors for suicide, so they're worth spending a bit of time looking at. But what we really worry about is when somebody has a bucket that's quite full with long-standing historical risk factors, and then they have some recent, new, current stressors in their lives that might be enough to tip them into beginning to engage in deliberate self-harm. So we'll have a look at what the data tells us, and it's a big, long list. But we know that, for example, I'll let you read them, but I'll highlight a few. We know that people who have come from backgrounds of trauma are at greater risk, or if they have social disadvantage or bereavement in their childhoods. We know that people who have an impulsive personality style obviously are at greater risk because they're more likely to act when they're distressed. So there's some of the factors that don't change very readily. So if they have a history of substance use, if they have a history of contact with mental health services, if they have a history of hardship, social disadvantage or trauma, they would be young people that you would be somewhat more worried about. But the recent type of factors really bear watching. So on the background of those long-standing risk factors, you might have a recent loss or a relationship breakdown or some particular stressors in relation to study or expectations about results, or there may be a new health concern, or they might have started using substances and be intoxicated. So if they're a young person who has a background of some trauma and distress, and then they take up drinking or amphetamine use, they may be more likely to act when they're intoxicated. So these are some of the factors that if they change and these things occur for a young person, you would be more worried about them. So another example is a recent discharge from a psychiatric hospital. We know that to be quite a high risk period for young people. I think they think that life might have been better, that they got a lot of care, that they wanted things to improve for them. And sometimes it doesn't feel that way. They get out of hospital and things are still very difficult. The problems are still there. So that is another example of a recent risk factor that sort of bears watching. So I hope that's helpful for you to see that list. In the interest of balance, I thought I'd also tell you that we know that there are many factors that protect against self-harm and suicide, and some of those are things that can be worked on, and they're things that schools can have an impact on. So we know that young people, for example, who feel connected and supported, whether that be to school or sporting organisations or a peer group, or sometimes just to a significant adult in their life, like a teacher or a school counsellor, that can be a very important protective factor against all kinds of actually poor mental health outcomes, including self-harm. People having improved physical health, so if somebody's been struggling with an illness and it gets well treated, that can reduce their risk. So there are many things that we can do to help to reduce people's risk of these negative outcomes. Okay. I can see that there's a lot of questions coming through. I'll try and pay attention to some of those shortly, but I'll just whip through a little bit more of this information. Okay, so what can you do in your role? I think we've already talked a little bit about the idea of not ignoring it, but the type of response that you give is really quite important. We know that young people who receive a less than ideal response to their first disclosure or somebody first noticing that they've been self-harming are much less likely to feel okay about ever seeking help for it again. So even if you don't have all of the answers and you're not 100% sure what they need to be doing, the way you respond, the support that the young person feels is very important. It's very important that they don't feel that their feelings are trivialised or they don't feel judged. And that you have some empathy for the distress that they're in. So if you do nothing else, letting them know that this is common and that it's something that young people do when they're struggling with very big, difficult situations and feelings, and that you care and that you want to see them find other ways to be able to manage their distress is a very good first step. So we would like to encourage you, as we were talking about earlier, to feel okay about asking directly whether somebody's thinking about harming themselves. And I think it can be really helpful for a young person to hear that they're not the only person who is having these thoughts. And it's quite common for people to have thoughts that they would be better off dead, that it's quite common for young people in particular to engage in deliberate self-harm. But they don't have to always act on those things, and that those are often symptoms of a treatable problem. So that really instilling a bit of hope that things can improve for them. I think that's something that we could, all be doing in our interactions with these young people. Okay, so just a couple of really practical considerations. It is really worth asking them if they require any medical attention and ensuring that first aid supplies are accessible. And to have in the back of your mind that some self-harm is an absolute urgent crisis situation and requires attention. So self-harm can be an emergency. So if a young person has consumed any sort of poison or taken an overdose, it is not your role to make a decision about, I don't think that's dangerous, or I actually think that quantity is okay. Our advice to you would be, if under any circumstance you become aware that a young person has ingested more than a prescribed dose of a medication, medication or consumed a poison. If they're looking confused or disoriented, or clearly if they're unconscious, that would be an emergency, or if they're bleeding in a rapid or pulsing way, you would be doing nothing else other than calling 000 and getting an ambulance to them very urgently. So they would be some indicators of urgency. Okay. Prevention of further self-harm. Whether or not you can enforce help seeking is, it's a really difficult thing. We would like to have a situation where all young people who feel distressed enough to be self-harming were able to seek and feel that mental health treatment was acceptable to them. But we know that there are many young people who don't want to seek that treatment, and it's usually not helpful to force them. Now, clearly, if somebody is engaging in something that is so very risky that their life is in the balance, then mental health services would be able to be seeing that person whether they were agreeable or not. But in most instances, it is best not to force the young person and to try and encourage them to seek help. Okay, so we want them to know what the help-seeking avenues are, both within the school and outside, and to think through with them whether there's somebody else that they feel that they can trust to talk to about this, especially if they feel they might do it again. Now, at the end of the presentation, I'll talk to you about a new app that Beyond Blue have recently developed, which is really fabulous, that is freely downloadable and can be on their smartphones, that helps them to think about what a safety plan might look like, what might they be able to turn to, what would be their early warning signs, what could they do in a situation where they were feeling very distressed. So I'd encourage you to check out that app because it's free, and we all know how young people are connected by the hand to their phone at any given moment when they can. So that's a great app to have a look at. Okay, some more very practical things. If they're actively suicidal, don't leave them alone. If they leave the school, we would be saying call the police. This is if we've deemed that somebody is actually at risk of wanting to end their life. At this point, you would very much want to be consulting with senior staff, possibly the principal at the school, reducing access to any means of hurting themselves, and very much that's a time to be informing and gaining support from a crisis service or a mental health service or a hospital, and getting the young person to an emergency department to receive a mental health assessment. At that point, you would also be wanting to think about making certain that family members were aware of what was going on for their young person. We know that confidentiality is a really tricky factor within a school. It can be very difficult to think about where that line is, about where you would want to make the situation something that could stay between the staff member and the student. We know that many young people are very reluctant for their families to find out about what they're doing that harms themselves. It is complex, and there are some situations where it is very clear. So if a person is actively suicidal, if a risk assessment's been done that deems that the young person is at risk of significant harm to their bodies or to their lives, then that is very clear. That is not something that you could keep secret. And our really strong advice would be, at the very outset, it is best for a young person to know that under those circumstances you cannot maintain their confidence, that you will be needing to let other people know, including their families where it's safe to do so, in order to keep them safe. At that point, you might want to give them a choice about whether they were involved in that conversation or whether they would rather you have that conversation with mum or dad without them. But we find that it is always best for an ongoing relationship with a young person if they know about the limits to confidentiality before they start to have the conversation with you, so that it doesn't come as a surprise to them when you do become so worried about them that you have to let other people know. Now, we would say there's a point that is where the risk is lower, where you may feel more confident to make a decision not to inform everybody. So you might not need to give all of the information about the self-harming to a teacher, as an example. But it can be helpful for teaching staff to know that a young person has some difficulties or has had some distress, or is there anything that you would like them to do, like let them out of staff to see the counsellor, let them out of class to see the counselling staff. So it might be a negotiation with the student about how much information is useful to be shared, so that the people around them can be supportive and consistent in how they respond to them. But there is a very clear line where the risk is high enough that we need to breach the confidence of the student in order to keep them safe. So I hope that helps you to feel a little bit clearer, because we get that question a lot. Okay, yeah. It can be really helpful to have a conversation with the student about what has helped in the past when they've felt this way. Usually it's not the first time that they have felt this way, so it can help them to think about that there have been other times where they've been able to get through situations like this, and to work through a safety plan with them. And that app can be great for that. It really walks you through and gives suggestions for things that can be in a safety plan. Okay, now this is another very big topic, but really important that the school spend some time thinking about. What happens in your school after an incident of self-harm? Are you really clear about who does what? What is the role of the wellbeing team? Who makes the referrals? Who checks on the other students who might have been distressed? Who lets the family know? At what point does the principal need to be informed? Do they need to be informed? Now, these are questions without very obvious answers, but we know that when there is a high stress incident of self-harm, that they're very difficult for schools to get right if they haven't done prior planning. So we would really like to strongly encourage you to be thinking about who does what in these circumstances. Does everybody know that that's part of their role? What does your school do well? What's gone wrong when you've had these instances before? Where's it fallen over? And not just about the immediate period after the incident of self-harming, but what happens in the days and weeks following. Who's following up with the other vulnerable students? Who's following up to make sure that the student themselves is okay, or attending class, or has the referral gone through that you thought somebody was going to be making? So it is really important that some time is spent within schools to think about some of these issues. And post-incident reviews can be very important. After an incident of self-harm, these are some of the things that we would like you to be thinking about. So who are the affected students? Who are the other at-risk students? How do we identify them? How do we know who within the peer group we should be worried about? Because we know that there are some young people without those risk factors who might be more resilient, who might be distressed and it passes. But for other young people, being exposed to an incident of self-harm can be very stressful and very traumatic and increase their own risk. So you need to have a think about who are those students and who's going to do that within your school. You need to think about providing debriefing and support to those identified people, and they could be staff, they could be other young people, family members. You may find that there are training needs for staff. So reflecting after an incident of self-harm might highlight the idea that there are some members of the staff group who have some gaps in their knowledge or in their confidence about addressing these issues. So that might be a useful outcome to a post-incident review. Implementing a structure for ongoing preventative efforts. So what are the school going to do to be increasing mental health literacy within the school? Looking at some of those risk factors that are preventable. Looking at some of those protective factors for their student group. And how we're going to go about ongoing monitoring systems for students who are at risk. And who's going to maintain the links with the student. So there's some of the things to think about. Now there's often a question about whether it's right or wrong for the student to remain in the school, and that's a really tricky question. Sometimes the answer that is in the best interests of the student who has been distressed and self-harming may not be in the best interests of the rest of the school. It's a really complex area, and I don't feel like I want to give you a black and white answer, but we think schools need to think about how they're going to assist the student to reintegrate back into school after an incident of self-harm, and that sometimes school is a very strong protective factor for that young person, and it is worth thinking about how they can be supported to maintain their education throughout a period of time that is obviously is quite distressing for them, a distressing time for them. Okay, so what do you do with the other students? Providing accurate information to students and staff while attempting to minimise contagion. It's a very easy thing to write on a slide. It's actually quite a complex thing to do in practice. We know that there is an increased risk of self-harm in the peer group of people exposed to self-harming. So these things do tend to feel contagious sometimes within schools. And in a little minute, I'll talk to you in a little bit more detail. So we would say accurate information is important. So it might be that you let people know that there has been an incident of self-harm, people who already know about it, that confirming that there has been an instance of self-harm, but you might not want to go into a lot of detail about the methods that the young person has used, for example. You would want to provide a forum for affected other students like class members to voice their concerns and to be really sure that they know how to access support within the school if they are distressed or if they're aware of other students who are distressed. And you'd also be wanting to talk to your teaching group about how do you keep things as normal as possible for the individual student and for the peer group. So you wouldn't want major changes to regular routines, for example, at this time. It's not containing. Okay. So a word about contagion. As I said, we know that exposure to self-harm increases the risk of self-harm in other groups of adolescents. The data tells us that that's particularly the case for young females, and it's particularly the case after cutting, after instances of cutting. So these are some recommendations that we have come across, and it would be interesting for you to think about how these things might occur within your school. There's not a great deal of very strong research evidence to back this up. These are recommendations from practice wisdom, really, that we would think about reducing detailed communication about self-injury among members of the peer group. So it wouldn't be encouraged that they spend lots of time in groups talking about what had happened. If there were any supports that were being offered by the school, we think they'd be best done on an individual basis rather than to groups, because there may be some students within those groups who aren't at risk. We don't want to play it up. We often get asked about the idea of whether students should be discouraged from displaying their wounds. Now, look, it's tricky. You don't want to be punitive. You want to be supportive. You don't want people to feel more shame than they already feel. But we know that other students being exposed to repeated reminders of instances of self-harm, those other students can become more distressed. And because there is a real risk of increasing the rates of self-harm amongst other students, look, you just want to do what you can to avoid that. So if you're able to be nuanced and subtle enough to be able to assist the student who is self-harming to cover up their wounds without making them feel blamed and criticised and feel more shame about them, that would be the ideal circumstance. Good luck with doing that. I know it can be hard. But yes, I think where possible we would say that it might be helpful for them not to be very obviously displaying obvious wounds, for example, because of the risk of distress to others. Okay, it looks like we did have some questions along those lines. Social media. So we have a question in terms of contagion. What do you do with a student who continually publishes stories involving details of self-harm on social media and pictures on Instagram? That's really difficult, and self-harm can be used both for absolute good and for absolute evil in the mental health space. We know that young people feel more connected, they can access good quality support and information online, but also there are times when social media can be really difficult, and that's one of those instances. We would think it would be very unhelpful for other vulnerable students to be regularly exposed to graphic details of self-harm, pictures of self-harm, for example, on social media. So in those instances, I think schools really should be thinking about, is there something they can do to discourage those types of things to happen? Now, I know they have limited control over what students do outside of school time and when they're not on school devices, but yes, that would be a very unhelpful thing for vulnerable students to be exposed to. So we really wish you luck with managing this. I think it's a very difficult new frontier for people who work with young people, very complex and much harder to manage than just what goes on within the school walls during school hours, very much so. Okay, looks like we're plodding along with time, so I might have to move through a little more quickly. One of the things that you can do after an instance of self-harm is to think about the support network that gets wrapped around the student concerned. And support networks are critically important. We would really ideally like everybody involved, which may include external agencies, to have a shared understanding of what is this young student's story, why are they self-harming, what does it mean to them, what do they need, what are they distressed about, what's happening for them that's led them to self-harm. But also to think about what are the best options for support. Is it that they're very well engaged with the school psychologist and not wanting to see the mental health worker, or vice versa? Are there too many services involved? Are they having to repeat and tell their story to too many people, and therefore it's not effective in any of the sectors? So it is always best if that the multiple services involved can be communicating about how to have a consistent response to the student, how teachers can be consistently responding, what are the best options for support for this student, because they really will vary from student to student. You can also share with the support network then what should be in the management plan. Who should they be seeing? When should they be seeing them? Should they be skipping classes? Do we need to reduce the demands on them in maths, which has been particularly stressful for them? Would that actually be unhelpful for them in the long term? And also then you have a team who can regularly review, is the management plan still appropriate? Is it still working? Does it need tweaking? And a couple of observations about who can be involved in wrapping that support around. We often get questions about how much should teachers be involved, often because of that confidentiality question. So I think it is worth thinking about the very important role that teachers can play. They're there on the ground, they see the student, they're making decisions on a regular basis about how to respond when they're distressed. They're noticing if something's changed and there are more concerns. So I think ideally where we're able to get the consent of the student and or their family, it is helpful if we're able to give some information to teachers about, possibly not detail because that might be too private. They may not need to know the nature of the trauma that the young person's experiencing, for example, but it can be very helpful for teaching staff if we're able to have it happen in a respectful, open way, for them to have some information about what's going on for the young person, so that they can do things like allow them to go and see the student counsellor during school hours if they need to, or they might get a green card to leave class if they're distressed, for example. So teachers can play a very important role in that wraparound support for a student. Similarly, families play an absolutely critical role in ensuring the safety of the young person. The trick comes in thinking about what information and how much information to pass on to the family. And I think it also works best when you can be very open with the families about the reasons that you might not pass on every piece of information to them. Now, that might not be very pleasing for families to hear, but they may be able to understand that in order to have the young person feel okay about accessing the support, for example, of a school psychologist, that they don't want every word they say going back to mum and dad. And mum and dad might feel assured if they're given a guarantee that if there are serious risks, that they will be informed. So, they're dialogues that are worth having with families and with the student about why you would like to have their families have some information. So we know that regular family consultation does assist with intervention planning, and it does assist where families are working well in supporting the young person's well-being. Okay, so you might want to have some information available for families about self-harming. You might want to give them some information about what you're going to do at school, and that might be reassuring for them that something is being done. We'll see the student weekly, we'll have somebody there to support them, we can assist you with a referral, that type of information. Okay, partnerships with mental health services. We know that you guys often have difficulty getting young people seen by mental health services. We know that there are many more young people needing to be seen than we actually do see, and that can be enormously frustrating for schools who feel left carrying the can of the risk and of sometimes some very complex situations. We wanted to encourage you that having contact with the mental health service can be helpful whether or not they take up the referral and assign a case manager. Many mental health services can assist with things like some consultation about the case. They may be able to have some input into a management plan or a safety plan, or thinking about what other supports might be available, or helping you to think about, they might even attend a case conference if you're really lucky. They might also be able to provide some information that might be of assistance to staff in their education about these types of issues. So we would like you to not be discouraged, and where there's a sniff of risk, we would encourage you to be contacting your local headspace or your local mental health service, whether you feel hopeful about them taking up the case or not. It is the appropriate thing to do when there's a risk that somebody's life may be at risk. Okay. Another word about school policy and guidelines. They're really important, and I know not all schools have spent a lot of time developing them specifically in relation to self-harm and suicide, but we know that schools that develop policies are in a much better position to prevent critical incidents like suicide, that they're more effective in responding when critical instances arise, and they're also more legally protected. If you've got a well thought out and documented protocol that you've followed and adverse events occur, you're protected because you've done all you can. So we would really like to encourage you, if you haven't reviewed your policy for a while, your protocols for a while, or if you think there's some gaps in them, it is really worth your while spending some time in the absence of a crisis period to go through them and to think about who you've consulted. Do they fit for staff? What do the students think about them? What do the parent groups within the school think about them? And who does what within them? And you can link them to your other policies like critical incident policies, drug prevention policies, welfare discipline policies, those sorts of things. Okay, they can include things like the goals and objectives of the policy, procedures that you would follow during a critical incident and afterwards, staff training needs, who does what to support staff and students in instances of self-harm. They could detail things like parents' involvement and have handy, ready information about referral contacts and points. So they're the very useful things to have when you're very distressed or upset or stressed about an incident having occurred in your school. So be prepared, spend some time, have a think about them. These are big tasks, we know, but they're better done before instances occur. All right, so before we answer a few of the final questions, I just wanted to leave you with a final quote from a young person. To help you really remind yourself about how important your responses are. This young person said to us that it is really unhelpful when I'm refused medical treatment for my self-harm, so there you could also think maybe care or compassion, just because I did it to myself. I don't need to be judged. I don't need to be told that there's no point in helping me because I'm just going to self-harm again. And that is a message that young people get over and over about their self-harm. So I wanted to leave you with the idea that your response really does matter, that young people do fear judgment. There's a lot of shame. They get a lot of negative responses. And it can be incredibly hard for them to talk about the things that they do to themselves. So do have a think about the next interaction you're having with a young person who might be self-harming and how you go about helping them to feel that this is something that they can talk about and that you understand that at the moment it is working for them as a way of managing really unmanageable emotions. And I think having them know that you understand that can be one of the more powerful things that you can do to that increases the likelihood that they will be able to help seek for their self-harming behaviour. Okay. So I thought before I take some questions I would just point you to some really useful further resources that schools can access that are readily available. Very recently a report was released by us here at the Orygen, the National Centre of Excellence in Youth Mental Health, entitled Looking the Other Way, Young People and Self-Harm. It has a lot of information about current data about self-harm, things that we know, things that we don't know, information for services. It's a really important read and it's freely available and downloadable on the Orygen website. So if you have an interest in this area or if it's part of your role, I would encourage you to have a look at it. Mind Matters has recently been updated in the last 18 months, 2 years. I'm not sure whether your school are familiar with it, but it is a wonderful free resource for schools funded by the Australian Federal Government to promote all kinds of better mental health outcomes for young students, secondary school students. So it promotes whole of school approaches to mental health and wellbeing. It has things to say on suicide prevention. It looks at student groups as well as individual student needs. So if you haven't already had a look at the resources and support available through Mind Matters, that would be a really useful thing for you to do. And there's the website there. I've mentioned before that there's a new freely available app that's been released by Beyond Blue. It's a great one. Young people are then encouraged when they're not experiencing suicidal ideation to have a think about what connects them to life, what their reasons for living are, what might be the early warning signs that things are going downhill for them, and also what they might do in the heat of the moment when things aren't okay. And it's there on their phone, you know, in their bedroom at midnight when things go wrong and their usual supports aren't there. So if you haven't had a look at that app, that's a great one to recommend to students. And in my searching around in preparation for this webinar, I stumbled across the Cornell Research Program's protocols on developing and implementing procedures for self-harm managing self-harm and suicide within schools, and it had some great tips. So I thought I would just let you know that you can Google self-injury in schools, developing policies, and have a read of this paper. It gives very practical information about who does what and what could be included in a school policy and procedure document or guidelines around managing self-harm and risk of suicide. So if you haven't come across it already, I think it's a really good place to start if you're having a look at your policies within your school. Okay, so I'll have a little look at the questions that have come through, and Simon might come back and join us. Okay, so we've got a question about risk assessment within schools. Look, there are many risk assessment protocols within schools. We have some of them that we could suggest here. You might even be able to find some. Simon's just showing me that the Headspace website.
Yeah, at the Centre of Excellence website with resources, there's a number of recommended
Risk assessment tools
around self-injury and suicide, including some assessment tools. And that's a great resource for schools and anybody working with young people with emerging or existing early issues in mental health.
And the part B to that question is who performs the risk assessment in schools, and the answer to that might vary from school to school. It really is about somebody who feels that they have training and competence in doing it. You want to have somebody within your school who can do some screening that indicates whether further assessment of this young person's mental health needs is required or not. That might be that you've got a student wellbeing staff member who feels able to do that, but it might be that your school needs to access the services of a regional school psychologist or student support services staff member. I don't know that the answer will be the same from school to school, but what I would like to encourage you to think about is that there is an identified person who feels okay about taking that role. It's really important that somebody can feel confident to ask questions to a young person about their level of risk and make decisions based on the information they get back.
And that person needs support to do that role.
Yeah, very much so.
And really, it's really important to have those school policies in place well before you need them in order to be able to test them and also to modify them to improve on them so that the schools can function when they're in crisis, when these sort of situations happen.
And I think it really is worth thinking about what is the backup for that person. What if they're not there on the day that things are difficult? And who's going to support them? Because that's a heavy role to hold within a school with a large student body. So yes, those things do all warrant thinking within each individual school.
We were overwhelmed with questions around confidentiality, and that doesn't surprise us. It comes up nearly all the time when we're working with schools. And I just, rather than answer them individually, there's a couple of points. We can't obviously speak about specific cases, although we appreciate it's very complex and difficult, but we do encourage, if there are existing workers involved, mental health workers involved, that they really are the people on the ground who can work most closely with the schools and support. And obviously Headspace, your local Headspace centre is a very important resource for you if you have one. And so it's really important to look to those agencies to get support around not only specific cases but also policies and processes within your school. They can help with that.
But we understand that confidentiality is difficult. We know that young people prefer us tell nobody, and it's a very slippery slope making that promise to a young person. We would really strongly ask you to talk very early to a young person about not being able to guarantee confidentiality. So it's not a surprise to them when you become worried that you need to let somebody know.
And we also understand that we're clinicians and we work within a different structure than schools, and that your processes and policies are different to a clinical setting, and so that needs to be taken into account when you're working with a young person. There was a number of questions as well, Karen, that were difficult for me to summarise around working with specific populations, vulnerable populations, young special needs students particularly. And I don't think that's an easy question to answer, but it is a complicated question which probably needs a lot more input than what we can offer here in a webinar.
Yeah, I other than to say that I think what we do know is that often young people who have special needs, for example, intellectual disability, do pose additional complicating factors for schools to manage. So we know that they're less able to communicate their distress in other ways, that they may be less able in some circumstances to anticipate the consequences of their behaviour. So they may be doing things that are quite dangerous without necessarily intending to. So we would probably think that we needed to be a little bit more cautious and concerned, and think more carefully about the supports that are in place for students with additional needs. We would consider it a factor that increases the complexity of managing them. Yeah.
There was another question about what we keep on talking about young people. And just young people in our world is anyone between the ages of 15 to 25, although even down to as young as 12, and it's a catch-all phrase, and that's a World Health Organization definition, but it don't let it limit.
People were wondering whether
what's a young person.
Who was in and who was out of that definition.
So we aren't limited by school-age children.
You could probably just substitute the word student when we talk about young person. Yeah. There's a question there about, generally, is there a correlation between the severity or type of self-harm behaviour and later suicide attempts? How do you determine if the suicide risk is high enough to inform others? Look, that is a really tricky question. And yes, we know that students, I won't say young people again, students who have more severe self-harm and more ongoing self-harm are at a greater risk of ultimately completing suicide, but that isn't always the way. And we all have heard of tragic circumstances where suicide feels like it's come out of the blue, and they're not the students who are very obvious. And so it's not possible to give you a blanket line that says you would be concerned about a student who was doing A behaviour and not B behaviour, or that there's a frequency with which you would draw the line. It isn't as simple as that. But we do know that some types of behaviours are more dangerous. So to give a very concrete example, it is harder to hold your breath and kill yourself, or even to cut yourself and kill yourself, although I feel cautious about saying that. But there are some behaviours that are very dangerous. So when students are talking about thoughts of stepping into traffic, or under the path of a train, or ingesting substances, you would be very worried. If people have access to hanging points, you would be very worried. So yes, some methods are much more alarming to us than others, but I don't want to give you the sense that if somebody is just cutting, that you wouldn't be concerned about them. That would be giving you a false sense of security, I think. You got anything to add to that, Simon?
Well, I think if you're not sure, then that's definitely a good indicator that you should get some more information and support.
And external
support. Yeah, absolutely.
Yeah. And when it feels grey, those decisions should never be made in isolation. No. Consult a colleague. Think about ringing the mental health service for a consultation, if not a referral. You shouldn't be ever feeling like you're needing to make those decisions in isolation. They're too serious.
Yeah. And tertiary mental health and clinical settings don't make those decisions in isolation either. They consult and they discuss with their colleagues and seniors, and that's how safety is ensured as much as possible.
People are asking if we can provide a link to the risk assessment that we mentioned earlier. I saw that you had it there on your phone, Simon. Where did you find it? There was a number
of very high quality resources. Yeah, you can find a lot of resources and material in the Headspace website. And that's headspace.org.au. There's a search bar. If you look in there for resources, you'll find lots and lots and lots of very high quality resources, particularly research materials, which might or might not be of interest to you, but they're very thoroughly examined by the experts in this area. And the Centre of Excellence can give recommendations about which is the quality material to look at. So it's a very good resource. If you obviously know where the Orygen website is, a number of resources can be found on there. If you search in the search box around self-harm or assessment, a whole range of materials come up also from there. So there's some, we don't recommend any one assessment. We recommend, it depends on the setting you're in.
Now, I realise that there are many questions, and I know we're going to be running short of time. This is an area that we would like to ask you to think about seeking further training in. We're not going to be able to cover everything in an hour-long webinar, so do have a look around locally as to what other training might be available. Orygen itself also has some additional information that you can access. Simon, did you want to talk about some of the things that we have coming up?
That's right, and we have another webinar that was recorded recently around deliberate self-harm by Dr. Louise McCutcheon, which is a very interesting one, which we recommend you have a look at if you're interested there.
There's also a module on our website
right,
with information about self-harm for families who are very new to the area of self-harm. So if they're coming across self-harming their child for the first time, there's some information there for families.
We have, if you search on our website on the campus component of it, there's a range of material in there. But I think it's time to thank you, Karen, for a really terrific, very compressed talk. That's usually
yes. Couple of days of training.
A couple of days of training, and we've got as much of that as we can. This webinar has been recorded and will be available, and all the participants, all the registered people will receive an email indicating when that recording is available on the website as soon as we possibly can. We also, your statement of participation and evaluation was sent to you shortly, and we do appreciate the feedback that we get from you. It actually, we're reluctant to look back at our earlier webinars. I can tell you that they're much improved because of the feedback we received from you, the audience.
I hope you agree.
We've talked a little bit about technology and social media. This is such a morphing and changing area. We encourage to get in front of that information as much as you can. And we actually offer an online training course, a certificate in young people's mental health and technology, and you can find that at the shown link there, Young People's Mental Health Technology, and that's in partnership with the Your CRC program, and it's a really fantastic program. We have another webinar coming up next week, and we're pretty keen to promote this to school settings because obviously it's around sport and mental health in young people. Sport is a big component of activities that young people undertake in schools, and we encourage this not only for sports teachers but also for the audience, the community sector. So please pass that on. We're very excited about that program.
That webinar will have a particular focus on looking out for signs and symptoms of mental ill health in young people. So if you're wondering, should I be worried? What would I notice? What would I see? That might be a webinar that would be useful to you.
And a special deal today, which it always feels funny to do, but we're keen to support the school sector. We have a manual around first episode psychosis, but a lot of material in it is relevant in all school settings around all young people with mental health difficulties. For this week, if you enter the webinar code, it is case sensitive. This manual will be available at only $30 through the web store. So that you go to the Orygen website and click on the campus and go through the web store. You click on that and then enter the code, webinar 2016, no space between webinar and 2016, all in uppercase. That will give you a discount. It's only $30. So I hope that's been useful for you. We also have a capacity we can run training and education in your workplaces, and you can contact us at Training at Orygen and we can give you more information about that. I would encourage, if your agency or school is really interested in this, we run a 2-day workshop specifically around this area because it's so complex and it covers in much more depth and detail some of the material that Karen talked about today. A number of people have asked us about copies of the slides, and we do not have copies of the slides available, but we do have a recording of the webinar itself. So, which
the slides will be a part of, so you'll be able to see them again, refer back to them.
That's right.
Yeah.
Thank you so much for your time, and we do appreciate that. We look forward to seeing you next week, and we hope you've enjoyed and found the webinar useful. Thank you.